will be around clinic. And the presenter will be Dr. Sydney Farai. So if you go to the chat box, you will find there is an Excel sheet for people to log in and their details so that you can get your CME or CPD points. So please, everybody, register on that on that sheet which has been posted. Without wasting any more time, I'll hand over to Dr. Farai to go ahead with his presentation.
Thank you, Dr. Minocha, the layover. My name is Dr. Farai. I am a consultant and a lecturer at University of Zimbabwe. I'm also a volunteer consultant at Adult Rep Clinic. I've been doing that for the past 5 years. So today I'm going to talk to you about the Adult Rep Clinic, what has been happening and the new things, and then we can discuss afterwards. This is going to be the outline of my presentation. I'll talk about ARC, Adult Rep Clinic, then I'll do a bit of statistics of things that have been happening in the past years and this year. And then I'll talk about the sexual harassment bill and law, which is being proposed, and hearings which are occurring currently. So Adult Rep Clinic, our vision is to have a society where sexual and gender-based violence is attainable, with the mission of having the provision of a comprehensive response to SGBV through quality medical and psychological services, awareness, raising awareness and advocacy training, and whilst not changing mindset and towards sexual gender-based violence. A bit of the background of ARC: it was founded in 2009. It was established in response to the dire lack of appropriate facilities for comprehensive and sensitive response for adult for rape survivors in government hospitals in Harare, and aims were to establish for replication throughout the country. We also trying to provide comprehensive management, including medical management, counseling and support services for all rape victims. The organization was formed in partnership with organizations providing complementary services such as ongoing psychosocial support, police and legal services, as well as prevention, awareness raising and advocacy around gender-based violence issues. It caters for all people, which is all survivors, all rape victims of all gender. So what are the services that we offer at Adult Rep Clinic? We treat basically rape victims and assess their injuries, document them. We offer pregnancy testing as well as emergency contraception if they are present within a reasonable time. We also offer treatment and prophylactic antibiotics for sexually transmitted infections. We do HIV testing and cleaning, as well as post-exposure prophylaxis is also offered in the unit. There's also examination of survivors and collection of evidence, forensic evidence, which is then documented. Some of it is documented and some of it is kept safe for future reference. We also offer psychological care and counseling, and we also offer a follow-up of care of these survivors. So we just don't see them and say, go away, but also then do routine follow-up, see how they are doing after managing them. Activities that we do include outreaches and awareness campaigns, all done to prevent sexual and gender-based violence awareness and campaigns. There's the common hashtag 272 campaign whereby we're encouraging people, the public, to present to the adult clinic within 72 hours, because that's when we'll be able to offer them prophylactic treatment for post-exposure prophylaxis for HIV, and also institute other management which is necessary. And also that's when you'll be able to pick up positive signs, because they would still be. Physical contact also involves mobile campaigns, roadshows, community dialogues that with the community. We are also involved in social media platforms. You've heard one of our colleagues also speaking on the radios, on TV, online, and key jingles, sometimes with popular comedians, so that at least we were able to reach all age groups and population, the public in Zimbabwe. So this is some of the trends in sexual violence cases we have seen at Adult Rape Clinic. Like I said, we initially opened in 2009, and there's been a steady increase in the number of cases that we have been seeing. Of course, the almost looks like an exponential increase in the cases that we have been seeing starting from the late 2018 to date. Probably this has been happening because of the awareness campaigns. People now know where to seek help, and they're now then approaching the unit so that they can be assisted. So as of 2020, like last year, we saw 1,330 survivors, which was quite a lot. And what has happened this year? So far, we have seen 417 survivors from January to date. Of note is that the majority obviously are females, 96%, and we only saw 4% of our clients were males. So we still see a sizable number of male survivors which who report the unit against all odds. Most people almost always think that men cannot be abused, but we also see quite a lot of number of these survivors who are males. Survivors, age distribution, you'd find that the majority of clients that we've seen this year are between 12 and 16 years old, the female survivors, followed by those which are between 17 and 24. And also worries that actually you see lots of female survivors ranging from 2 years up to 11, still coming to the unit seeking assistance. So what has been the characteristics of the perpetrators that we've been documenting in our unit? We find that the majority of survivors have been abused by someone whom they know. And about a quarter have been abused by someone, a complete stranger whom they don't know. And then trends of sexual violence from January to May, we have seen it, like I've told you, we've seen a total of 470 cases. So this graph here, these are absolute figures. Between January and February, we saw less than 80 people, less than 8 clients for both for January, and also less than 70 for February. This was during the time of lockdown. I'm sure you're all aware that it was difficult to be mobile, for survivors to come and seek assistance. After the lockdown, when the people were allowed to move around in March, we saw a peak of clients that we saw in March. This could have been attributed to availability of public transport. People were now able to seek medical attention, and we saw late presenters whom could have come earlier on. The number of clients that we have seen in April almost like stabilized. And of those cases that we'd seen in those months, obviously they were ranging between 78 to 88% were reported cases. Obviously, the standard is that every case of sexual violence should be reported to the police. Of worry is that between January and February, that's when we had the lowest percentage of survivors presenting within 72 hours. Remember, we want them to come in within 72 hours so that PEP will be effective, and then we also offer the appropriate management and to record injuries, because then they will still be fresh. So only about 20% of clients that we saw in January presented within 72 hours. There has been a steady increase in the number of clients who are presenting within 72 hours. But of note is that we are still less than 40%. Like 40% of all our clients that we see then present within 72 hours. The majority present late, and sometimes it's then becomes very difficult to assist them to complete. So talk about some of the activities that Adult Rape Clinic has been doing currently. So we have been involved in the part of the constitutional amendment programs, particularly the Sexual Harassment Bill and Law. So in consortium with other organizations, the Adult Rape Clinic has been to advocate, and there are public hearings that are actually occurring currently quite about this bill and law proposal. So I'll talk a bit more about this bill, what it is. You find that I'll mostly be talking relating to things that are related to maybe sexual harassment at work, and in political parties, religious areas, like in the public domain, public and private domain. But I would also then pinpoint in terms of in our practice as obstetricians, because at one point, some of us would be affected or involved in sexual harassment, which I think we should be aware of this bill and its implications in the future. So according to the ILO and UN, women's sexual harassment as sexual forms of unwelcome conduct and behavior towards another person in both public and private spaces. A common example is when a woman is asked for sexual return for being given a job, a promotion, or a pay rise. In our constitution currently, section 51 of the constitution says every person has the right to bodily and psychological integrity, which includes the right to freedom from all violence from public or private sources. So types of sexual harassment comes in many forms. It can vary. It can be in the form of spoken words, unwanted bodily touches, which can affect the mind, or even something that can be seen. So where does it occur? It can occur at workplaces. Employees can be harassed in a variety of ways at the stations. This may include any unwelcome conduct or behavior regarding sex, gender, or sexual orientation. Sexual is not limited to touching or spoken words. It may include indecent images, videos, emails, and even staring in a suggestive manner. It can also occur at institutions of learning and religion. From primary tertiary education, learners may experience harassment in any forms which include sexual assault, molestation, rape, which can be in return for favors given to victim in obtaining higher grades. This applies to religious institutions where religious leaders take advantage of their authority to make unwelcome sexual advances on victims. I'm sure we have all read some point in the media about lecturers asking for sexual favors from, and so that a student can pass. So these are all forms of sexual harassment. It can also occur in public places whereby we say sexual harassment can occur in women, for example, who are seeking just basic transport. I'm sure we've all seen these instances whereby a woman is at Copacabana there, and she's being harassed by passerbys. Sexual comments about a person's clothing are unwelcome body contact, such as intentional brushing up against a person, are some of the examples of sexual harassment in public places. Also occur in politics, whereby we are saying political structures, those with authority, then influence and can commit harassment by demanding sexual favors from others in return for votes or getting positions of power. It includes incidents of unwelcome sexual advances, verbal, physical, contact, or sexual nature made directly or indirectly. So sexual harassment can be found anywhere. Forms of sexual harassment, basically in the society, they are mostly committed by seniors holding higher positions. It could be in any organization, it could be in a hospital, it could be a political party. So in essence, any person having authority, influence, or moral dominance of another in a political party demands a request or otherwise requires any sexual favors from the other, regardless of whether the demand, request, or requirement for submission is accepted. So submission conduct is made either implicitly or explicitly a condition of being for or appointed to a position by any person of higher authority. So it can also involve use of objects, pictures, letters, or written notes with bold, persuasive sexual suggestions, which create a hostile, offensive, or intimidating environment which is annoying or disgusting to the victim. Other forms of sexual harassment include telling sexual or dirty jokes, displaying or distributing sexual explicit drawings or pictures, rating people on their physical attributes, or comments about a person's clothing, body structure, or looks. It may also involve whistling. It may also involve name calling, staring in an offensive way, unwanted questions about one's sex life, unwanted touching, hugging, kissing, fondling, brushing up against someone's body, stalking, Eventually, sexual harassment eventually leads to sexual assault, molestation, or rape. So all these forms of harassment are being advocated against so that we prevent the sexual assault and rape. So what are the effects of sexual harassment? It may cause self-doubt, discomfort, displeasure, and humiliation to the victim, as it may be used as a basis for demotion to a senior position in either maybe in a party or any organization. It creates an unfriendly, intimidating, and unpleasant working environment that causes negative impact victims' participation in different social political sectors. So what needs to be considered in this Sexual Harassment Act? So there's no law in Zimbabwe that criminalizes sexual harassment. The law prohibits sexual harassment at workplace. So sexual is considered as one of the unfair labor practices, and employer can be held liable for civil remedies only. So we are advocating that Zimbabwe endorses the International Labour Law Organization Convention as a first step towards the recognition of progressive work-related rights in this treaty. They clearly state that no provisions for sexual harassment, including imprisonment of doers. Because currently we don't have the law, people just get away with it. But what we are saying is sexual harassment then may lead to sexual assault. Other considerations that are being put forward are to make sure that there is adequate and capacity of friendly units across the country so that they are able to provide favorable environment for victims to report their cases and also to gather evidence. There's also need to set up dependent complaints mechanism accessible to all survivors and protection mechanisms for survivors or whistleblowers. The government must also make it mandatory for political parties to adopt the Sexual Harassment Act once made into law and ensure that all political parties members are made aware of it and the consequences of violating it. Also advocating to set out rules regarding media coverage of sexual harassment cases and the protection of and the identity of so that they are able to continue with their lives after their encounters. We need to set guidelines and regulations to protect women candidates, for example, in political parties from sexual harassment, assault, during elections, and bar anyone convicted of sexual offenses from contesting for public positions. And also to include free medical and psychological support for survivors, which Adult Rape Clinic is offering, but obviously it needs to be documented, probably supported through government structures, so that at least people can be assisted. We should not also forget about our disabled counterparts. So should also include use of all languages, including Braille and sign language for awareness and all communication. Remember, some of our survivors are also disabled, and they will need communication and so that they know about where to seek assistance. So other remedy proposals include lawyer secondary liability for sexual harassment, whereby we're saying an aggrieved employee can sue the employer if the person perpetrating sexual harassment is a superior employee who is capable of being taken as an employer in terms of Section 2 of the Labour Act. This may include managers, directors, and their representatives or other senior executives of any company or organization. Interjection or instruction, any wronged party can approach the courts and file for an interdict or both prohibitive interdict barring sexual harassment and a mandatory interdict, either employers and their agents to act in a manner that prevents sexual harassment or forestals sexual harassment. So we should also then advocate for reporting of sexual harassment to bodies for disciplinary action. Currently, obviously, we have our Medical and Dental Practitioners Council of Zimbabwe, whereby anyone who has been aggrieved or has been sexually harassed can report to MDPCZ. This means that as colleagues, we need to modify our practice. Remember, we also deal with most of our patients or are females. If you are not able to handle them carefully, you can actually be reported to MDPCZ. And if this law is then passed, imagine the consequences. If, for example, we're advocating for a mandatory sentence, a jail sentence for sexual harassment, meaning that if one is found guilty, then it can have dire consequences. I would advise me probably to make maybe when we examine our patients, for example, I'll take an example because I do most of vaginal examinations, like ultrasound scan, transvaginal ultrasound scan, vaginal examinations. You'd need probably a chaperone so that when you examine your client, there is a decency and you reduce chance of probably negligence, and so that you are not reported sexual harassment. So AM is found in Paringatwa, Ward C9. Those are the contacts if you want to get hold of any one of the reception or assistance at any point in time. And we're also on social media platform whereby you get hold of us and communicate or be a whistleblower. And these are my acknowledgements, adult rape clinic staff and organizations. So I think this ends my presentation. I'm not sure if there are any questions, clarifications.
Thank you very much, Dr. Farai, for that presentation and for bringing enlightenment into a very important issue around this sexual harassment bill. It's I think it's really important that people take part in the conversation around the enactment of this bill, and knowing that we are several years behind on it, and that even as we are acting on the bill, we should also be thinking about how we are going to enforce it in our own circles, and even just the conversations around getting people to understand what sexual harassment is, because maybe you're a perpetrator, maybe you're a victim, and you are unaware because you don't actually know what the boundaries are and where they are being violated. So we will invite any questions. If there are any questions or comments from anyone, you can post in the chat group or unmute yourself and go ahead and ask. So far, I was checking on the chat and I didn't see any questions or comments.
There's a question now, Dr. Mensch.
Okay, yeah. So it says, is there a policy that rape victims have to bring a police report before getting treatment?
No, there's no policy like that. Some rape victims actually may not want to go to report their cases. So there's no policy which prohibits assistance to survivors if reported to police.
I hope you are answered, Dr. Magwenzi. Any other comments or questions? Okay, if there aren't any at the moment, we can invite our sponsors who we are so grateful to, Pulse Pharmaceuticals, who have supported us so many times as a society. So we are so thankful to them and would like to give them a few minutes just to take us through a short talk.
Hi, Annie. I just wanted to find out from Dr. Farai, what is their current experience in STI testing? Do they have any data, and are their clients who are reporting sexual assault, are they readily assessing assays to test for, chlamydia and gonorrhea and all those things? And then I also wanted to know, do you have access to genetic testing? I mean, DNA testing in terms of litigation, in view of litigation and things which may end up in court? Thank you.
Okay, thank you, Prof. I'll tackle the second question first, whereby it said we just collect the evidence. Actually, genetic testing is not being done, or probably we don't have the facilities, and the government, we don't have a supporting structure to test for genetics. So the forensic evidence that we gather, we hope that probably in the future, when we're able to do this readily with assistance, then able to then do them. But I think I once presented in one of the ZSOG meetings, maybe 2 years ago, before the virus, and I highlighted to you that to the group that this genetic testing is not available, and in other countries, for example, first world countries, it has been introduced more than 4 decades ago, and still in Zimbabwe, this facility is not available even in courts. For STI, we at other rep clinic we do tests for STIs, but not always do we test for chlamydia and gonorrhea. Most of the times we are just treating the patient symptomatically. So there are some patients that we test, and there are some that we don't. And the main reason for that is that of funding and who's going to pay for the test. So that's the problems that we are facing. That we don't have enough funds to then routinely test everyone. I don't know if I've answered you, Prof.
Yeah, I know you have. Maybe I'll talk to you offline about assistance, particularly for those who are coming to PARI. Our lab is just, as you know, in the department. And yeah, we can work out something so we can talk offline about that for STI testing. Thank you.
Thank you.
Before we go over to the sponsors, I will just take a couple of questions that were posted here. One is, where can we get help in procuring rape kits for forensic evidence collection? Dr. Farai.
I think they can obtain it at other rep clinic. We've got lots of other rep clinic kits which are available, which can be used.
Okay. And another question is, any comment on male victims? Is it only sodomy, or there are cases of females raping males?
It's both. Like I've said, from my experience working in the ARC for the past 5 years, one of the scenarios is a male being raped by a group of females, which to me looks like a ritualistic event. Normally, I'll give maybe a case scenario whereby one client came to us. He said he had bought a private car, and then he was offered a drink, and then I think the drink had been spiked, Then he passed out. When he passed out, he woke up in a place that he didn't know where it was, and then he was repeatedly raped, and his semen was collected probably for ritualistic purposes. So that's the common scenario. And the other one, sodomy, is also quite common, but the commonest one I think is whereby males are raped at gunpoint or under threat against their will. Yeah.
All right. I'll just keep checking on the chat group, but for now we'll cross over and have our sponsors give a talk to us. And if there's any other comments or questions, you can put them in the chat and we can have Dr. Farai answer them after.
Thank you very much, Dr. Mnocha. Good evening, everyone. Once again, my name is Rachel Mandidewa, medical rep for PSI South Africa Social Enterprise Group, and I'm based at Pulse Pharmaceuticals. So today I'm going to give a talk on the new product we recently launched, which is called Muri. It's an oral contraceptive pill. Okay, so today I'm going to talk about the product Muri, which is an oral contraceptive meal, combined oral contraceptive meal. We launched it in November last year, and it's now available in most of the pharmacies in Zimbabwe. And we have launched this product because we have seen that there was a gap between if somebody who is on COC, there was only the controls and there was no other option if the controls were not working well for that person. So we have introduced Muri, which is now available. So what is Muri? Muri is a low-dose combined oral contraceptive pill containing 150 micromilligrams of desogestrel, which is the progestin, and 30 micromilligrams of ethinyl estradiol, which is an estrogen. And it's a third generation oral contraceptive pill, which means it's a plus for us. It has got less side effects. And it's it has got a monophasic formulation, which means each tablet contains a fixed amount of estrogen and progestin. And it's very effective. The efficacy rate of this tablet is 99.7 if adherence is good. Then why are we saying Muri? Muri is very good because it's highly effective. As you have seen the efficacy rate, which is 99.7, which means it works very well. So if somebody wants to be on a family planning tablet, you need something which is very effective, and Muri would be a good tablet to be on. And it's also very good at cycle control. There are no challenges of them spotting, because as you know, with other family planning methods, there are challenges with spotting, but when you're on this tablet Muri, there are no cases of spotting. So it has got a very good cycle control. And it also provides a reversible and convenient method of family planning, because if one wants to conceive, it's not difficult to conceive. So it's a very good tablet, because if people come asking for family planning methods, they want to find out if retention to fertility is easy or difficult. So when you are on Muri, retention to fertility is very easy. So that becomes a good drug for most ladies, because that's the most question that they ask. And it also reduces premenstrual symptoms like dysmenorrhea. So for those ladies who complain of dysmenorrhea pre and during the menses, this will be a very good drug for them, because it reduces the pains. It also reduces heavy bleeding during menses. So for those ladies who come in complaining of heavy bleeding, Muri will be a very good option for them, because it reduces them bleeding. Then it's also very effective on it's positive, it has got a positive effect on lipid profile. So there are no issues of weight gain when you're on Muri. So especially these days, as you know, ladies are very particular about their weight. So this is a very good drug for them, because if you are on Muri, there are no problems or the challenges on weight gain. So it's a very good drug for those people who are particular about their weight. And it also decreases severity of acne and hirsutism. Especially these days, the ladies are also very particular about their looks. So this is a drug which most ladies would like because it reduces acne. So that's the package of Muri. It comes in a package with, it's just one cycle, 28 tablets, and it's packaged in a box. Then the box, the foil paper is inside the box, and it contains 28 tablets. 21 of them are the active ingredients, and the 7-day one it's a placebo. They only contain iron. So that's the package for Muri. Then what are the contraindications for Muri? There are no serious side effects since the 3rd generation, so the side effects are very minimal, and the contraindications are if somebody's suspecting that they are pregnant, you cannot take Muri. You need to go for a pregnancy test first before taking Muri. Then if you're hypersensitive to the drug, you are also contraindicated to the drug. Then undiagnosed vaginal bleeding is also one of the contraindications. We need to find out the cause or the reason of vaginal bleeding before we commence somebody on Muri. So we need to do thorough history before we commence somebody on Muri. Then if somebody has got heart disease with complications, we also need to do thorough investigations before we start somebody on Muri. Then hepatic liver conditions, a liver function test should be done before commencing Muri also. Then if somebody also has a current history of migraine or blurred vision, since it will be one of the side effects, we need to find out from the person before we commence them on Muri if they've got a problem with migraine or blurred vision, so that it will be easy for us to find out if it's being caused by the product or they had the problem before. So we need to do a thorough investigation before we start somebody on Muri. Then what are the Muri side effects? Since we have said it's a 3rd generation oral contraceptive pill, it means it has got minimal side effects. The side effects that we have is nausea and vomiting, breast tenderness, headache, and not everybody will complain of these side effects. It's maybe 1 or 2 cases, and maybe for the first week or first days, then the problems will go away. But if the problems continues, they need to see a doctor. Then in conclusion, what are we saying? We are saying is doctors, when people come in asking for family planning, most of the things that they want to know is, does this drug work? And as I have said, the efficacy rate of Muri is 99.7, which means it's a very good drug and it works very well. So it answers this question, which most of the ladies will come in with. Then, won't it be difficult for me to conceive? That's the other question that most ladies will ask. And we have got an answer, Muri have got an answer, because retaining the fertility, it's very easy if you're on this tablet. So that would be a very good drug, and Muri is also answering that question. Then the other question will be, what are the side effects of Muri? We are saying this is now a 3rd generation oral contraceptive pill. Hence, it has got less side effects. So we can safely give to the ladies because the side effects are very minimal. Then once I have a weight gain, and Muri is also answering to this question because there is no weight gain if you're on this tablet. So Muri is one of the tablet which is answering most of the questions which ladies do ask. Then some of the ladies will also ask, will I have regular menses? And we are saying Muri is very good at cycle control, hence regular methods are always there. So Muri is one of the good tablets which most ladies would prefer to have. And I think most of us, we know with the active ingredients that we have said in Muri, they are the same with the ones, I think most of us know Marvelon, which used to be there. I think it was phased out. It was not in the market for the past 5 years or so. So Muri is the same as Marvelon, because when Marvelon went dry in the market, many people were still asking about it, and we thought we should bring it back. But the only difference now is the name is now not Marvelon, but Muri. So it's the same drug as Marvelon that we used to know, and it's now available in most of the pharmacies in Zimbabwe. So please feel free to prescribe because it's now available. And those are my contact details. If somebody wants to ask something or wants more information regarding the product, you can get hold of me on those contacts. I'll be at Pulse Pharmaceuticals. Thank you. I think that's the end of my presentation. And if you've got any questions, please feel free to ask.
Thank you very much, Rachel. There's actually a couple of questions for you. I will read out two first. Someone was asking if a hypertensive patient can use Muri, and also what is the average cost?
Okay, that's fine. Yes, a hypertensive person can use Muri, and the average cost right now, I can tell you the cost from Pulse Pharmaceuticals is $3, and most of the pharmacies are selling it between $4.50 to $6, depending with the pharmacies. And currently, we are in the process of checking to the medical aids to see if it can be covered by most of the medical aids. So I'll update you or on the progress on the issue of medical aids.
Okay, and there's also a question about what is the risk of thrombotic events while using Muri? Is it similar to the usual combined oral contraceptive pills?
No, with this one, there are no problems when you are using it.
So I'm assuming that means it being a hormonal contraceptive containing an estrogen, the average risk would be the same as other estrogen containing pills.
But this one is a low dose. Now the doses are very low compared to the other tablets. The doses are low. It's a low dose.
Okay. Thank you very much. If there are any questions, I'm sure people have seen your contact details and they will be in touch. And then just going back to Dr. Farai, Dr. Moyo was asking if there is a copy of the draft bill and where the hearings are being conducted. And also, is the adult rape clinic involved in the actual drafting of the bill? And I guess that applies to other stakeholders who are dealing with gender-based violence.
Okay, thank you. Thank you for the question, Dr. Moyo. Yes, there is a draft bill that is there, and adult rape clinic is actually involved was involved in drafting that bill, and the hearings actually have been happening the rest of this week. I think I know there was a team, part of our team, which was in Plumtree today, and in our as well yesterday. There was also a team which was in Mutare. So the hearing is actually being done currently wide. There are different teams which are going in different provinces from the different organizations that are involved in drafting the bill.
How can people find out where the hearings are being conducted? Is it in the papers, on social media?
I think it's from social media. I'll try to link up the adverts from social media to the groups that I am in, that people can attend to these hearings.
All right. Dr. Moyo asked if you could circulate the draft.
Okay, I will do that. Thanks.
Okay. Any other comments? If there's any people who have not yet updated the spreadsheet which was posted on the chat, please do that so that you can get your CPD points. Oh, okay. Is there any other comment? All right. Thank you very much, everyone. And thank you so much to Rachel and Pulse Pharmaceuticals. We really appreciate your support week after week. And thank you, everyone, for making the time to join in and learn on this very important bill, which we all need to participate in. Thank you very much, Dr. Farai, for taking the time also to present to us. I did not get any other announcements from the society or from the scientific committee, so I'm sure they will update us in due course as to when the next meeting will be. Have a good evening, everyone. Stay safe, and I hope we are all vaccinated.
Thank you.
Yeah.